Okay, chapter 16, 7th edition of the NASM Certified Personal Trainer textbook. Chapter 16 is on core training concepts. And just like we've done with the prior chapters, please keep in mind, good idea to have some paper and writing implements so you can take notes. As well, it's not a bad idea because there's some review in here from some of the previous chapters. And as always, my recommendation is go ahead and draw some things out. Drawing it and then maybe labeling it can actually be really beneficial to the memorization process. So of course, core training is it's kind of a big thing now, and it's something that we know is really, really important, particularly for detrained individuals. And so there's a necessity for understanding the concepts behind exactly what the core is and what it's not, and all of the training program variables that go into it. So, chapter 16 is going to give you a real good basic understanding of not only what the core is, but also core training principles and program designed variables. So what is the core? What is core stability, right? You have your sidebars again for definitional purposes. So core stability, core endurance, and core strength. For the most part, we talk about the core and we just say, well, it's your midsection, it's your abdominals. But in reality, the core, when you look at the core musculature, we normally, and we saw this before in one of the previous chapters, this idea of these two sort of subsystems of the core musculature. One is the local muscle subsystem and the global muscular sort of subsystem, if you want to call it that. The local muscles, right, within the core are the main stabilizers of the spinal column and the pelvic and lumbar hip region. So local muscles, couple of things to keep in mind. Now, once again, just learning the definition and just learning the muscles is one thing. But if you really understand what those muscles do, what positions they're in, and what their main functions are in the global system as well, it actually helps you not just from a training standpoint, from the academic component as well. So yes, you do need to look at tables 16.1 and you do need to memorize those muscles, but it's not that big of a deal. I mean, you got 1, 2, 3, 4, keep going, 5, 6. So you got just a couple of muscles and muscle complexes that you need to memorize. NASM has done a great job in their images to kind of show you where these muscles are located. And so it's important, obviously, before we get into it, to look at table 16.1 and basically memorize these muscles and understand both the local core musculature and the global muscle system. So local muscles are the ones that are the closest to the spinal column itself, and there's a listing of those muscles here, obviously in table 16.1. Key thing to remember about the local muscles versus the global, which are more superficial to the spinal column. The local muscles are generally muscles that are predominantly type 1 muscle fibers. Keep in mind that when we talk about stabilizing muscles or anything related to spinal stabilization, pelvic stabilization, shoulder, any of the stabilization type muscles are normally going to, now here's some terminology. They're going to be in static isometric contractions. Remember what isometric, static isometric, which means they're tense, but they're not lengthening or shortening. They're providing the structural reinforcement to ensure that the spinal column maintains its proper position without moving out of alignment, without flexing or extending, and allowing for the pelvis and the hips to also maintain these static isometric positions that are necessary when we do other movements like walking, running, all of these activities, any type of physical activity you can think of that involves the movement of your arms, I mean, throwing a baseball, jumping, all of these things require a pretty good amount of stabilization in the local core musculature, i.e. the spinal column itself and the spinal column and its connection to the pelvis and to the pelvis bones in that area. So local muscles, core musculature are predominantly type 1 fibered muscles. Why? Because those are the endurance fibers. And so they need to stay contracted, right, for extended periods of time. And so they're involved in stabilization. So anytime you see the term stabilization, like in the OPT model, you see stabilization, really what we're talking about is training these muscles that are predominantly type 1 fiber that are designed to hold whatever it is they're connected to hold it in place with very little movement over an extended period of time. It does not mean that those muscles do not have type 2 fibers. Of course they do. Every muscle, even the local muscles, like the multifidus and some of these other muscles, they all contain type 2 fibers. It's just that their predominant muscle type, 60%, 65% of all the muscle fibers in a muscle like that are predominantly type 1. And so it's important to remember that the slow twitch endurance fibers. So figure 16.1 gives you a real good view of the local core musculature. And then the global musculature are those muscles also involved, right, to a certain extent with stabilization, particularly dynamic stabilization, that are more superficial. So when we talk about the core, we're talking about, for the most part, we can define the core superiorly, right? The diaphragm up top, all the way down to essentially those muscles in the lower pelvic region, or the LPHC, lumbo-pelvic hip complex. So all the muscles down there that are involved with stabilizing the hips and the pelvis to the femur. Those would be considered the lower end or the inferior aspects of the core. You also have back to the spinal column, all the way to the front, right? The abdominals are anterior, right? They are in the front of the body. They are part of the core. So you have this entirety of this grouping of muscles that comprise what we call the core. There's local stabilization muscles, and there's global stabilizing and other muscles that move the move the torso, flex and extend the spine, lateral movement, torsional movement along the transverse plane, so rotation, things like that. So again, table 16.1, as it moves forward, you got to memorize this. This is really, really critical that you know these muscles, know what their primary actions are, and just appreciate what they do for within the HMS, the human movement system. You can't be lifting weights out to the side. You can't be doing, you can't run fast unless those stabilizing muscles in the LPHC and the spinal column are really functionally holding everything in place, right? So they have to be working efficiently. They have to hold everything in place so that this other stuff can move and flail around like we do when we're doing certain exercises. The interesting thing, of course, is that we see folks with, particularly athletes, with really, really strong global muscle strength, like the gluteal group, the abdominals, and all of those muscles in the global core musculature that are really well developed, very strong, able to do primary movement, but funny enough, do not have very strengthened and endurance capable local core musculature. Remember, at the very heart of your stabilization capabilities in the spinal column and the hips and pelvis are those local muscles. So make sure you know them, make sure you know their primary actions. If you cannot pronounce them, don't worry about it. Go Google it and you can get a pronunciation. So the quadratus lumborum, I don't know if you could say that incorrectly, but Fact of the matter is that there's a lot of muscles in here that you need to know that are really, really critical when it comes to um, core stabilization and understanding both the local and the global core muscles. And core global muscles and on page 519, and the importance of properly training the core muscles. And then there's a scientific rationale. NASM wants to make sure you understand there is a scientific reason for training the core, and it makes good sense. Again, you have sidebars on page 520. Again, here's your review: lordotic curve, lordosis, kyphotic curve, the normal curve of the thoracic spine, and then kyphosis, which would be a over or hyper kyphotic curve that could be clinically significant or cause pain and discomfort. Anytime we have any of the kyphosis or lordosis issues, it's normally going to be associated with either anterior or posterior tilting of the pelvic girdle itself. So the pelvis will tilt anterior and posteriorly, and so the spinal column is going to be a good indicator as you see kyphosis or lordosis. Now, I will say that when you get to page 521, one of the interesting things, and perhaps not in the best way, is that the figure 16.5 is actually turned, I'm not going to say the wrong way, but normally we see the anterior of a on a picture. I'm just throwing this out at you so you don't get confused. But normally the pictures that we see of the pelvis lateral view uh, conventionally has the anterior view. You're looking at somebody from the side. Normally the anterior view is to the right, posterior to the left. I'm just to make sure you don't get confused when you look at figure 16.5. For some reason, they flipped it and they have the anterior view facing left, posterior facing right. Just making sure you don't get confused. Again, by convention, academically, we normally have anterior facing to the right, posterior facing to the left. And but with that said, it's important to understand now in figure 16.5, this concept of pelvic tilting. And if you look at the one drawing here on top and one on the bottom, you can see that circular motion that shows us the tilting posteriorly and anteriorly of the pelvis itself. Now, keep in mind, this is got to go back now and think back to one of the terms we talked about. And this relates to this force coupling. Remember I said previous chapter, we have force coupling at the scapula, right? Scapula rotates. This is where we see the force coupling issues at the pelvis. And I'll go ahead and draw this out for you so you get a better feel for it, which is that as soon as my camera comes into focus, I'm going to be able to show you what this looks like. So remember, the pelvis itself, and I'm just going to draw I'm just going to draw kind of make it look a little bit like the pelvis. This is I'm doing it the way NASM did it in the book. That's the front, that's the anterior part of your body, and this is the posterior. Remember what we said about force coupling, right? There is movement in a circular pattern this way, right? Okay, so that's what's going to happen if the force coupling pulls, like muscles are pulling this way or muscles are pulling this way. And if you have these two lines of pull, what's going to happen? Well, you're going to get this rotational movement like this, right? So rotates this way because the rotation occurs because of the local and global muscles pulling in these. This is what's known as a force coupling. If I do it the opposite way, and I have muscles that are pulling this way, for instance, and muscles that are pulling this way and pulling like this, and there are muscles that do this. If I do that, what's going to be the direction of pull? Well, obviously the pelvis is going to pull or turn this way. Now, in figure 16.5, in 16.5, figure 16.5, that's basically what that's showing you. Okay, it's basically showing you that there are muscles in the global and local core musculature that do just that. What are those muscles? Well, they are the hamstrings, for instance, the iliopsoas. You've got the erector spinae and the other hip flexors. You have the heel group. Now, that's not particularly shown in this top photo, but you can see obviously the point is that the force coupling that occurs because of overactive. Take a look, figure 16.4 and 16.5, overactive and underactive. And this is where, again, if you remember, what is an overactive muscle? It's one that shortens beyond its length, ideal length tension relationship. We're just reviewing now for the most part. And if you have an overactive hip flexor complex, what's it going to do? Well, it's going to create a force coupling with an overactive erector spinae, just as a for instance, okay, and that's that first part of figure 16. You just can't overemphasize enough that there's this mechanical reality that occurs when muscles are overactive and others are underactive, and boom, the pelvis twists. That force coupling now causes this this postural dysfunction, and when that happens, that affects then the lordotic curve, right? It's not the lordotic curve is a problem first, and then that does, right? Normally, the causative issue, right? Remember, cause and effect. The causative issue is generally going to be because of muscles that you are pre-shortening because of the way you're spending the majority of your day or time. Think about standing and just slouching, right? If you stand all day and you slouch. Remember your parents or your grandparents would tell you, don't slouch. Put your shoulders back. Pull your shoulders back. Lift your chin up. Come on, pull your shoulders back, right? That's what I was told all the time. All right, lift up your rib cage. Now, that lifting up the rib cage is a cue that I use with my clients when I'm training them. Every time I'm doing an exercise, I guarantee you they're going to drop their rib cage. They're slouching, right? So terms like slouching are colloquial terms that we use in our everyday communication, but they relate to these other terms like upper cross syndrome, basically slouching with your head forward for the most part. Well, if you can remember that, it makes it a lot easier. And then if you just allow your pelvis to tuck up underneath, or right, we see these other issues and distortion problems. So remember, the pelvis is a strong driver, right, because of force coupling to the positioning of the spinal column. You just gotta have to keep that in mind as you're trying to memorize. Scoliosis is a lateral deviation. Scoliosis is never good. Just so you know, the more and again, that's something that you see from the rear, from the back. Okay, you can see in figure 16.6, scoliosis is a lateral deviation, right? The normal curve from a lateral view is this little slight S curve, right? That's normal. You have to have those little curvatures to allow for appropriate movement of the spinal column. But the lateral stuff, that's no good. It should be a straight line, ideally, straight line. What ends up happening, by the way, with scoliosis, just sort of as a sidebar, is that scoliosis, because of the lateral deviation, causes compensations. And when those compensations occur, they tend to lift one hip higher than the other. They tend to elevate one shoulder girdle complex higher than the other. And then there's a compensation, right? If your spinal column is twisting you like this, well, you're not going to sit there and walk around like this all day. You're going to compensate. Okay, and I've trained a number of clients. I trained one client. She had scoliosis so bad that it was clinically significant to the point where she had to basically have her spinal column they say they would break the break her back to realign her vertebrae, because what happens is as that thoracic um, region starts to squeeze and push on the organs. So scoliosis can be clinically very significant. But remember, most people have some slight bit of scoliosis. It's not something that you generally ever have to worry about. I have scoliosis. I have a slight angle down in my pelvis. Hasn't caused me any issues or problems. And most people that have that abnormality normally don't have really any issues. It's only when it gets so bad that it becomes clinically significant. So that's the concept of the anterior posterior pelvic tilt. Again, it's sort of like a review, but now we're looking at the muscles that are involved with this. When muscles become overactive, underactive, they create this altered force coupling issue that then puts stress on the spinal column, creating this lordosis, which is a hyperlordotic curve, kyphosis, which is a hyperlordotic curve. As we move through into pages 522, 23, the idea then is that core musculature strengthening, right, and efficiency has a profound effect on performance, injury resistance and rehabilitation. One of the things, of course, that they'll talk about here in this chapter is low back pain, LBP. So low back pain, I think right now 80% of all clinical visits to a primary care doc are for non-specific LBP, low back pain. It's actually a diagnosis, LBP. What do you do for it? Well, what most doctors, at least the ones that I know, will do is, they give you muscle relaxants and some medication. But nowadays, what they're looking more at is helping individuals to become more active, to stretch out the overactive muscles. Look, as a personal trainer, you know what the issue is for the most part, provided it's not clinically significant. But if it's just the muscles, due to poor posture and poor positioning of the skeletal system over time, we know how to fix that. Come on, we strengthen the underactive muscles, and we foam roll and stretch and static stretch and squeeze and massage out the overactive muscles. And then we teach our clients, we become like their mom and dad. Lift up your rib cage. Come on, shoulders back. Come on, squeeze your shoulder blades together. Lift your head up. Okay, don't let your neck jut forward. I sometimes feel like that when I train people. It almost feels like I'm their dad. Don't slouch. Don't slouch. Get your rib cage up, pulling your abdominal, which is ironically enough what we're talking about here in 524, the drawing in maneuver. Basically, if you think about it, if you stand up nice, tall, and straight, think about taking your belly button and pulling it back towards your spine. That's called drawing in, right? Creating this concave positioning of your abdominal. We call that the drawing in maneuver. You can actually do that as a training modality. You can actually have new clients just do the draw in maneuver. I have people exhale and they try to pull their abdominal back towards their spinal column. That's called the drawing in maneuver. Ironically enough, if you get people to do that, sometimes you can have them lie on the ground and do it. I've had clients do that as well. They lie on the ground, arms out to the side, and they exhale, and they try and flatten their back out and pull their belly button back behind them. They call that the drawing in maneuver. There's also what we call abdominal bracing. How do you explain abdominal bracing? That's sort of if you take a deep breath and you hold your breath and you try and tense or push down on your abdominal region, and you can feel your abdominal region kind of tense, right? It's almost like you're trying to tense your abdominals and your obliques and everything before you exhale. You don't want to exhale. You basically take a deep breath and bear down on your abdominal region, and you hold that for 5 seconds, 10 seconds, something like that. There's a way, there's programmatically you can do that. By the way, don't do it and do this, squeeze and, pop the blood vessels in your eyes. That's not what you're trying to do. So abdominal bracing, technically it's the co-contraction of all those global muscles in that area, right? So you're tensing everything down, or, sometimes as they say, bearing down. You can actually use those maneuvers as core training exercises for people that are detrained. And ironically enough, for athletes that don't have really strong local core musculature strength. Okay, you can actually get them to do that, hold those while they're doing their other training exercises, and then in between training exercises, you can do a draw-in maneuver for 10 to 15 seconds in between doing some other core training that you're working on. So guidelines table 16.2 is just basically giving you the different variables. When you do core training, try to do it in all 3 planes of motion. Try and do full, partial, end range of motion. End range of motion simply means that you're bringing whatever the body position is into that position and holding, and in some cases even tensing it, right? Remember, isometric contractions. That's really what you're trying to engage when you train your core. There's any number of exercises, and once we move into the next couple of pages, designing a core training, NASM has given you a whole bunch of exercises, and that's basically what page 530 all the way to pretty close to the end of the chapter. It gives you a bunch of great exercises that you can incorporate into a core training routine. But before that, core training progressions, as well as the 5 kinetic chain checkpoints. Look, we're simply in a review section that is now giving you the additional muscles and actual progressions that you would be using when you start doing the core training. Remember, we talked about the 5 kinetic chain checkpoints in previous chapters. So feet, knees, hips, basically, the LPHC, the shoulders, and the head and neck, right? Those are the 5 kinetic chains. So you'd be looking to make sure that people are doing not only correctly, but you're training all of those areas, because all of those kinetic chain checkpoints require stabilization while you're doing exercise. It's one of the reasons why we recommend that you create what NASM calls a proprioceptively rich environment. And all that means is that instead of sitting down and doing dumbbell presses with people for their shoulders, have them sit on a stability ball. Better yet, have them do it standing, right? There's nothing wrong with doing it standing. I normally have my clients always do what's called an offset, 1 foot forward. When I'm doing standing or dumbbell curls, I always have my clients do an offset, because that destabilizes the pelvis a little bit, gives you a better sort of base of support. But the point is that as we go through here, look on page 528 at the different core progressions, and NASM has given you a good number. Look, you can train people for years with just these exercises that you see here. And so core training requires progressions. It also requires that you have proper form and technique. And their focus, what they're basically saying is, look, there's 5 areas of 5 kinetic checkpoints, chain checkpoints, that you need to be looking at and monitoring and helping people work through. So here are your core exercises. Read through them, of course. There are safety components, technique and safety. Your goal, remember, your goal, by the way, with core exercises is not to use heavy resistance. Isometric contractions, movements into isometrics, movements out into isometrics, breathing properly, ensuring that you can, if possible, do the draw-in maneuver as well as the bracing while you're doing it. So all the different exercises that are available. Again, isometrics. And just real quick, when you do like a medicine ball throw or oblique throw, remember, these are movements that you're using. So there's global dynamic stabilization, but there's also local core musculature stabilization. The goal is not to just allow your body to roll forward and just throw it as fast or as hard as you can. That's not the goal. The goal is to be very, very specific in the movement pattern so that everything is stable while you do this movement. Quite often what I'll do is have clients go on a Bosu ball, stand on the flat side, which gives them an unstable environment, and do ball throws. But they do it very controlled. And what that's doing is it's creating an unstable, remember, unstable means proprioceptively rich. Unstable environment, proprioceptively rich. That's kind of the way you got to think about this. It helps when you're taking a test as well. So as you move through to the end of the chapter, they've given you a bunch of great exercises to do. Now you're at your, again, chapter review, your summary, page 541, chapter review, okay, and your chapter highlights. So that brings us to the end of a really important chapter, although it's not as long as the others. It's really important, and you've got to know these concepts, even though it was review, and try and memorize those exercises as well. Because it's really important that when you're doing any type of training program, you are including core training, core stabilization type training in your exercise routine. So that ends chapter 16. I look forward to seeing you again, chapter 17.